I am Dr. Larry Onyango Akoko. I am a general surgeon with the Muhimbili National Hospital and a senior lecturer with the Muhimbili University of Health and Allied Sciences in Dar es Salaam, Tanzania, with 10 years working experience. When I first heard of surgical oncology, I thought it was basically the same practice I've been offering. And so when I got a scholarship and admission through Merck African Oncology Fellowship Program, oncology services have been offered through medical and radiation oncology and the use of general surgeons or gynecologists and orthopedic to do the surgical aspects. But 2 years back, there was a trained clinical oncologist from Tanzania who had attended as the first Tanzanian to train in medical oncology through the Merck African Oncology Foundation program at Tata. Cancer care in my country has some good aspects and some challenging aspects that needs improvement. The good aspect is the government from the very beginning, over 30 years, had realized that cancer care was a chronic disease where the patients were going through an unknown journey. Nothing was certain in the line of care. And as such, the government had tried to relieve patients of catastrophic expenditures by declaring cancer treatments free. Once a patient is diagnosed with cancer, they got their services free. But the focus was mainly on offering chemotherapy and radiotherapy services. While in global data cancer statistics, this is an organ that gives global cancer statistics and country-specific cancer statistics. 8 out of 10 top 10 cancers are treated by surgery, and there has been no training to add this arm into the treatment, because without proper surgical oncology, even the medical and radiation oncology would not yield their stated benefits as evidenced from developed countries. In Tanzania, 7 years ago, we only had 5 oncologists who were all near their retirement age, which is 60 years. So that had forced government to extend contracts to most of the oncologists, to almost all of them, who were over 60 years and tired. And so Muhimbili University of Health, where I work, had embarked on a deliberate effort to have homegrown oncologists. So we started a program of clinical oncology, which basically trained both medical and radiation together in one person. So our most cancer statistics are very scarce, but according to global statistics, CS cervix is the leading cancer, with the most patients coming with advanced disease until 2 years ago, when screening programs through USAID and PEPFAR-funded programs started screening and treatment of CS cervix. And that made CS cervix to jump almost triple the initial figures before the screening period. So during this 1 year of training, I've done extensive training in breast cancer. I've also done very extensive training in hepatobiliary and pancreas cancer, where I spent 3/4 of my time and seeing close to thousands of patients imaginable. And I've also spent good time with colorectal cancer. So we have established units that are already working with these patients. So I will join those units because I need to multiply whatever I've learned to work within existing units, improve their skills wherever they are deficient. But there is a great lack of surgical oncology specialty in Tanzania and in Africa. So number one, I'm going to improve my surgical oncology training to the general surgical residents as a short-term bridge to improving surgical oncology program. But number two, I'm going to work together with the interested parties to build short courses into promoting surgical oncology, because I think just as I was, many people do not understand what surgical oncology is. And so I hope with the partnership through Mike will be able to train more surgical oncologists. My insights on that is cancer care is multidisciplinary. If you train alone, you'll get frustrated. Patients are very difficult. So that's what I learned at Tata. It's multidisciplinary. There is no single man who can claim he's a Rambo. So I'm going to mobilize that team of different specialties to work around me. And it is my hope that future trainings will consider improving this team. If it was not for Merck Foundation, I think I would not have been able first to make it, even to know that there was opportunity to train in surgical oncology that would be affordable to somebody from a low-income country like me. So I'm very grateful in sincerity to Merck Foundation for both the financial and logistic support that they offered. Tanzania.